All right, and then I'll share my screen here. Okay. So we'll get started. As usual, this is for school and health department personnel. We'll post the recording and slides on our website, but if you're not with the school or health department, I'd ask you to talk about. And I just ask everybody make sure their computers and phones are on mute. Thanks. And just make sure you pass along any needed information to others in your school or office that may need it. So first, real quick, I know I get some questions on this. This is just some information that came out this week about a potential fourth dose vaccine for the non-immunocompromised. So earlier this week, Pfizer did submit an application for a second booster dose, but it would only be for those adults that are over 65. So not for the general population, and it really is based on just a very small amount of data. So a small trial that only included like 150 people in Israel, I believe. So again, that's the current situation with a potential fourth dose or fourth booster would be, again, Pfizer did apply this week for that, and it would be for those that are 65 and older. So whether or not they're going to approve it is pending. But there's a lot of debate about that, whether we should just continue to recommend more and more boosters, or we should really, work more on a better vaccine that might have a better coverage to cover more potential variants. So again, I know I get questions on that, so I just wanted to give you the latest news. The other thing I just want to let you know, our media people from District 10 put together a really nice graphic here that gives an overview of the testing clinics we do still have available in the District 10 area. So again, we still have many opportunities for community testing in the area. On April 15th, the site in Ludington closes, but until that time, we have testing available in Kalkaska, Ludington, Hart, Cadillac, Fremont, Big Rapids, and Grayling. And again, there's other sites available. You can find those on the state website. So again, just remember that separate from what you may be able to provide at the school or with home testing, there are still sites available. Obviously, we're seeing a decrease in utilization, so just wanted to remind you of that. This is information that was copied to us, the health department, from documents that we were advised were emailed to you guys earlier this week. So I just wanted to review it, make sure it looked familiar to you. And if not, you went back and looked through your emails from, I'm pretty sure it was Monday that it went out. And if you can't find it, maybe ask your ISD, and if not, we can always forward it to you. But there are some upcoming meetings coming up for the schools regarding testing from the state. So they have meetings for the ISDs, for superintendents, and for private or charter schools. They're going to discuss their antigen testing, the HRA programs, backpack testing programs, and kind of the collective multiplex testing options they might have in the fall. So again, just wanted to point that out, that you should have information on that from earlier this week. Also in that information, they had some reminders about reporting of test results. They did initiate a more official, what they call pause and count, where they kind of stopped and looked at how much reporting is being done by schools, and really relying on how much is being reported back with regards to how much they're going to be sending to the schools. They also mentioned that it sounds like they're switching back to the way they used to do it, where ISDs need to order now rather than the individual schools. So just, can't keep it simple. So they had again, in those documents, information that for schools to order, schools need to reach out to the districts, and then the districts need to order, and they had a link to the ordering form. If you do testing on site, you need to report that through the portal. That then satisfies your requirement to report it to public health. So if you do testing and you get a positive result and you report it through the portal, you don't have to call us separately to report that positive, is what they're saying. You can if you want us to know sooner, but you don't need to. There's not much utility to that. So again, that's all that's in that document. Again, if you can't find them, they should be in your email. We have copies of them if you need them. This is really busy. This is a copy and paste of a document, or a web page, I should say, from the CDC, just general information about spring break, kind of bringing that up, that's coming up. Their information is just kind of general guidance about spring break. Number one talks about COVID. The rest is just kind of general healthy tips for travel, includes COVID guidance, but also just other healthy things as well. There's no specific guidance regarding COVID. There are some countries that may have different guidance, so each person really is encouraged to check into that before they travel. You can think about maybe offering or having some post-spring break testing options available. One of our health departments had brought up, the idea that if you're interested in doing some extra, whether it's mandatory or just optional testing, if you have HREs in your area, they likely are happy to help with that extra testing. I also put in the link for the community testing sites and other testing areas, so that if you have individuals who are in need of testing when they come back or desire testing, you have those resources available. But again, if you are interested and you have the resources for offering screening testing like the weekend after spring break or the Monday before people come back, if you have HREs in your area, likelihood is that they'd be happy to help performing those tests. This is a little bit busy as well, but just to point out, some may not be aware, or some might be confused about this because it wasn't put out in a very clear way about this change. But on the 11th, the state did officially rescind the October 6th, 2020 epidemic order. That order was the one that required you to publicly put a public notice of the COVID cases that impacted your school or school buildings. So basically, you no longer must provide that public notice. You can if you wish, or if you think, you have families that really rely on that or would be frustrated by not having that information, you certainly can still do that. But that order is gone. That order also did discuss how we must report to you and you must report to us. That doesn't necessarily go away. The public health code still requires that schools need to report, and I put this here just so you have it. But schools, child cares, and camps must report within 24 hours. Any occurrence of a serious communicable disease that is on kind of the list of those diseases, and that list, there's two links to it here. COVID is on that list at this time. So just because this special epidemic order is going away, that requirement to report COVID to us does not go away. Again, you can work with your county nurse or your HRA. What's the easiest way to do that reporting? Or if you haven't heard from that individual in a while and things are cumbersome to you, I encourage you to reach out with them to talk with them about it. You're also required still, just as you have always been, if there's any unusual occurrences, outbreaks, anything weird going on, to report that as well. And hopefully in those situations we can help figure things out with you. Another document that was posted on the school website in COVID, so if you go to the michigan.gov/coronavirus, on the top part of the screen, there's a tab that says resources, and in that drop down, there's a K through 12 guidance tab. And then on that page, that's where you'll find links to these things I'm mentioning. So they have a document that's called School Guidance for School Administrators and Local Health Departments. They just kind of touched up a document kind of going over some of these requirements and recommendations and things. So this is just some of the text from that document, just kind of a reminder, that we partner together, providing guidance, and that, you still have your independent legal authority to protect your students. They did put this might look familiar. We had provided a document similar to this in the fall. Again, they just kind of touched it up. And they discuss here again, reporting cases and the outbreaks. They do again mention the Public Act 339 with regards to your employees. One mention of that is that one of the criteria for return to work after an exposure or with regards to isolation, they state as advised by a public health professional. So that gives you flexibility as some of the recommendations from us or from MDHHS or from the CDC, as those are changing, to perhaps not recommend or require the full quarantine period or things of that nature. That gives you the flexibility, kind of a third option, so to speak, with regard to that act. And then there's different recommendations in that document, just talking about, making sure you do have masks available, so someone does want or need them, those are available, and, really recommending following all the other health recommendations for COVID. And finally, right after we had our talk last Thursday, the state discussed with us that they were releasing their new recommendations much earlier than we expected, and a bit more lenient than what we expected. So one thing, again, this document is on that same school page that I just explained how to get there. They do point out that this is for our stage right now, kind of in that post-surge recovery period. And if things get worse again, we might have to tighten this up again. This is just the basic table they use to explain it. So isolation is pretty much the same with the 5 days at home and the 5 days with a mask. Their suggestion for quarantine applies really to all situations, whether it's school, workplace, personal life. They don't really differentiate now between school settings or other settings. They kind of have a personal or household contact definition, and then everything else, their personal or household contacts are household contacts or people that share a living space, and then others who may have had direct exposure to respiratory secretions. So kind of that high intensity contact like we talked about last week. Their recommendation for that high intensity exposure is to monitor for 10 days, wear a mask for 10 days, and get tested once. At this time, they have kind of moved away from the CDC, and they are not suggesting any quarantine at all. Again, this is their suggestion. For the other lower risk exposures, they're suggesting to monitor for 10 days, consider wearing a mask, and test if you have symptoms. So this is just the text part of that document. From the school document, they state that those who are positive need to notify their own contacts. The role of the school is to have a communication plan to provide timely and accurate notification to parents, guardians, and school staff if there is an exposure in the school setting. And then with quarantine, they talk about quarantine to respond to and control outbreaks. What I wanted to do, again, talking about the personal and household contacts, it's kind of like our higher risk. And they do talk about that you can use test to stay, although they don't have that really in their plan. I wanted to kind of get into a comparison between what we talked about last week and what the state has recommended. So again, all of this, what the CDC recommends, what the state recommends, what we recommend, it's all public health guidance. You can really choose to follow what you are most comfortable with. The guidance may change as situations change. The CDC really is the most conservative and cautious. The state right now is providing kind of the least conservative guidance, and ours is sort of in the middle. So kind of those new terms or concepts with the contacts. Again, the state has used this personal or household contact, which are essentially those where you could have had a more intense exposure. Ours last week, we talked about high intensity contact. Sorry, I did not take out that low intensity contact verbiage there. So high intensity contacts would include the following, essentially the same as what MDHHS is talking about when they talk about personal or household contacts. So last week we talked about what to do if you're sick or tested positive for COVID. We broke it down a little bit more detailed with regards to whether or not you had symptoms and did or did not get tested, did or did not get a different diagnosis, things like that. They just kind of have this, if you're sick or if you have symptoms or tested positive, here's what you do. So really it's the same. We just tried to give you a little bit more detail for those what if scenarios. Where it really differs is for the exposure. They've really taken any consideration of vaccination or prior illness out and have taken any concern about higher risk exposures out, in my opinion. Basically, there's no quarantine, there's no test to stay. So, you know, as we're dealing with lower case numbers, that may be okay. You know, those higher risk exposures are going to be your highest risk for spread. About 10 to 20% of those do end up getting infected. So if you have the ability to do test to stay, that is going to keep illness out of your school to the greatest degree. Again, you can follow whichever plan you wish. I would just watch and see how things are faring in your school. Looking at how the U.S. as a whole is doing, again, we're not quite down to our lowest levels yet, still kind of that slow taper. I did pull some numbers from Europe compared to us. We in Canada are really coming down. Unfortunately, there is some concern because some of the European countries are starting to increase again, mainly due to the BA2 variant. There is hope that won't necessarily affect us. We are seeing increasing numbers of that in the US, and we're really not seeing any change in our case rates. So hopefully that will be the case. I did pull out just the UK, Italy, and Germany here, so you could see that a little easier how they're having a second spike here. So from our modeling report this week, you can see our positivity, our cases, daily cases per million, and the percent of hospitalizations due to COVID continue to come down. really well. So again, good trends. This again is updated late every Thursday, so we'll have new data later tonight. But Michigan is largely in the low community levels for COVID. Most of the US is as well. So promising. This is really busy, I know, but I just wanted to put here what the numbers actually are so you can have it as a reference. We do still have some counties that have higher community levels, but we're getting there and definitely on the right track. Hospitalizations and ICU levels are what are really, really good. Our hospitals really needed the break, and so that is definitely a very promising trend. Pediatric hospitalizations are only at 23, still not at our lowest, but getting there. The state had put in a slide just to kind of point out, that nearly 500,000 kiddos had COVID throughout the pandemic in Michigan. Just over 3,000 had to be hospitalized. About 40% of those did not have any pre-existing conditions, and 258 so far have had the MIS-C condition. So just to point that out. And this is showing vaccination rates for our kids. The solid lines are the 12 to 15-year-olds, and the dotted lines are the 5 to 11-year-olds. The pink line is completion, and the blue is initiation. So just showing that those rates have really just kind of fizzled out a bit, especially, our younger age certainly did not get as much vaccination as our older age group there. So just to show that. This week in the US, 23% of the variants are the BA2. I was on a call this morning and our epidemiologist said that we've had 99 identified in Michigan. Certainly a very small percentage of all of our cases are genotyped. So, kind of hard to put it in perspective, but it's still not really considered to be a major issue in Michigan. As a reminder, last week it was 11.6, so it's doubled. I think the week before it was 8 something, and the week before that it was 3 something. So it seems to be doubling about every week. But again, our cases overall in the US don't seem to be going up. So that is a promising sign. In a second, I'm going to add to the chat before we get to questions. I'm going to try to, I've never done this before, but I'm going to add a poll to ask how often you would like to continue to have meetings. I know that, I can still usually provide you some little new tidbits, but I didn't know if you wanted to keep having meetings once a week, or if you want to go to every other week, once a month, or just stop having regular meetings for now, and we will email you any important updates. And if there's something more complicated or if it's requested, then we can schedule a meeting. So what I'll do is I'll put those questions into, if you just bear with me 1 second, I'm just going to quick make a form and put that in there. In the meantime, if you have any questions, please put them in the chat, and then later we will open it up for questions. Okay. So hopefully you all got that. Again, I've never done this before, but just go ahead and vote. And again, if you have questions, put them in the chat. If for some reason you can't vote, you can always email me, and I have another poll set up in another system I can always revert to if it's not working. So, so the first question I have is, what are the dashboard reporting requirements? So I think you're talking about the dashboard from the October 2020 epidemic order. And as of last week, that order was rescinded. So there are absolutely no requirements anymore. So that you don't have to do that dashboard at all anymore. And I think Penny just answered that as well, but just for the sake of the group. What does MMDHD recommend for quarantines? So I recommend, and I think my health officers agree, I recommend what we put out last week, which is for those high intensity exposures, my preference would be for a test to stay guidance. But if that's not possible, you can quarantine. If you feel, I'm completely fine with you allowing them to continue at school. If you feel they can continue to wear a high quality mask while in class, if you feel the risk of lost education is greater than the risk of infection. You know, if you're seeing really low numbers, you know, I want kids to stay in school as much as possible. And if you're really not seeing much spread at all or much infection at all, and you just can't do tests to stay, you know, again, those are some of those individual choices you just kind of have to look at. If you're starting to see a lot of infection in your school, I don't want all of your kids to miss school because you have so much absenteeism you have to shut down for a week. So I know that's a complicated answer, but I'm a bit nervous about the amount of change with the new state guidance. You know, I understand the desire to want to not have to worry about things anymore, but I also worry that we'll have a lot more to worry about if we don't stay vigilant. So that was the last question in the chat. If there's any other questions, I would just have you put that in the chat or go ahead and unmute. Or if you're having any issues voting, to type your response in the message box, or you can email me if you're on the phone and you're unable to use Teams right now. So far, it's looking like once a month is winning by a hair. Every other week is close. My one concern with every other week is I do believe in 2 weeks we might be hitting a good number of people's spring break. So I think I'll keep an eye on the poll, but my feeling might be to go for a month from now just because of spring breaks. And again, we'll email any major updates to you in the meantime. And if there's a need for a more urgent meeting, we'll do that. What I would ask you guys, though, is if at any time you feel like we need to meet, or there's a lot of question or internal discussion about not understanding something new, please let me know. If you have questions in the meantime, please let me know, because I don't want people to be out there frustrated and we not know about it. All right. So what we'll do, it looks like we'll go with a month from now. We'll send out a new meeting invite. It should be the same call-in info, but just for 1 month. And then at that time, we'll decide if we want to stay with once a month after that. All right, last call for questions. All right, guys, thanks. We'll get the slides and the recording out to you. Have a great month and great vacations if you get to go anywhere nice.